All right, today we're going to talk about a condition that affects millions of people, but honestly, it's just so misunderstood. It's called Chronic Obstructive Pulmonary Disease, or COPD. Now, it's one of the world's leading causes of death, but as you're about to see, it's a disease that's very often hiding in plain sight.
So let's just start with a number that's, well, it's staggering. Estimates suggest that around 70% of people who actually have COPD don't even know it. Think about that. That is a huge number of people living with symptoms they can't explain, and it's fueling what a lot of experts are calling a hidden epidemic.
So you gotta ask, right? What exactly is this disease, and how could something so incredibly common stay so frequently undiagnosed? Well, let's pull back the curtain and really figure this out. Okay, so to really understand the challenge here, we have to start with the basics. We need to define the disease. Let's take a look at what is actually happening inside the lungs of someone who has COPD. You know, what I find so interesting is the official definition, which comes from the Global Initiative for Chronic Obstructive Lung Disease, or GOLD. I want you to notice two keywords here: preventable and treatable. That is such a powerful message of hope, and it's one that often gets completely lost in the conversation. It tells us this isn't just some passive diagnosis, it's something we can actively fight. So mechanically, what's going on? Well, imagine your airways kind of losing their springiness, their elastic recoil, and becoming narrower. So when you breathe out, not all the air can actually escape. It gets trapped inside. This whole process is what doctors call airflow obstruction and gas trapping, and it leads to something called hyperinflation. Your lungs basically feel like they're constantly a little too full of air, which makes it really hard to take a deep, satisfying breath. It really is like trying to breathe out through a pinched straw.
Now, there's this huge misconception out there that COPD is just a smoker's disease. And while, yes, tobacco is the #1 cause, it is far from the only one. The GOLD report makes this super clear. Everything from household pollution, think cooking with biomass fuels, to dust and chemicals at work, and even how your lungs developed when you were very young can play a major role.
Okay, so we've kind of laid out the problem. Now let's pivot and talk about the solution. Because modern COPD management is about so much more than just reacting to symptoms. It's a really proactive and, frankly, a pretty comprehensive toolkit.
The entire philosophy of modern COPD care really comes down to this two-pronged attack. First, you work to reduce the symptoms you're having right now, like breathlessness, so you can improve your quality of life today. And at the very same time, you're working to reduce your future risk, things like preventing flare-ups, which doctors call exacerbations, and slowing down the disease's progression.
And here's the crucial thing to understand. The management toolkit is incredibly diverse. Yeah, of course it includes medications like inhalers. That's the pharmacological part. But look at these other categories. Things that are non-pharmacological, like pulmonary rehab and exercise, are just as vital. And then you have the preventative stuff, quitting smoking, getting your flu and pneumonia shots. That's really the foundation for long-term health. It's a whole person strategy.
Right, and managing COPD is definitely not a set-it-and-forget-it kind of deal. Care is a continuous loop. You assess the situation, you manage it, but the most important part is this review and adjust cycle. A person's needs are going to change over time, so their therapy has to be dynamic. It's got to be constantly evolving, and that happens through a real partnership with their healthcare provider.
And this brings us to what I think is a really critical shift in modern medicine: empowering the patient. The goal is not just to treat a disease, it's to help people live well with it.
Oh, I love this quote from the GOLD report. It just perfectly captures this massive change in thinking. We're moving away from that old model where a doctor just kind of tells a patient what to do. The new model, which they call self-management support, is all about collaboration. It's about giving patients the tools and, just as importantly, the confidence to become active partners in their own care.
And this is exactly what that support looks like in the real world. Tools like the COPD Foundation's action plan use this super simple traffic light system. Green means you're doing great, stick to the plan. Yellow is like a caution flag. Your symptoms are getting worse, and it's time to follow the steps you and your doctor already agreed on. And red means it's a severe flare-up, an emergency. It's simple, it's clear, and it's incredibly empowering.
So let's bring this all the way back around. We started this whole conversation with the problem of underdiagnosis. So let's finish up by looking at the absolute key to overcoming it.
Because here is the bottom line. All of those amazing management tools we just talked about, they're totally useless if a person never gets a diagnosis in the first place. Millions of people are out there struggling with symptoms, delaying care that could change their lives, just because they don't know what's causing it.
So how do we fix this? Well, the answer is often surprisingly straightforward. It's a simple breathing test called spirometry. It's totally non-invasive, and it just measures how much air you can breathe out and how fast you can do it. This little test is the absolute gold standard for confirming a COPD diagnosis.
And that's really the ultimate takeaway here. While no, there isn't a cure for COPD, it is absolutely a treatable condition. Getting that diagnosis early on is the key. It's what unlocks the entire management toolkit we've been exploring. And that allows people to slow the disease down, manage their symptoms, and live fuller, more active lives.
So we'll just leave you with this one last thought. You know, that persistent shortness of breath or a cough that just won't go away, that is not just a normal part of getting older. Your breathing is telling a story. The only question left is, are you listening? Thanks so much for joining us.